Okay, I'm going to show you the pGTI digital platform. I will do so by telling you about a 14-year-old African-American patient with lupus. She is in a clinical trial, had lupus for 2 years. Lupus has been characterized by discoid lesions and photosensitivity and diffuse proliferative glomerulonephritis. The first thing that one does in a clinical trial visit is have the coordinator update the patient's medications. The patient is on insulin at baseline, 10 units of NPH insulin. She is also on a medication for her blood pressure. She's on lisinopril, 20 milligrams a day. Next, we move to vital signs. The patient is 1.53 meters tall. The digital platform calculates the Z-score automatically. The patient weighs 78 kilograms. The patient's blood pressure is 144/92, despite being on lisinopril. And the vital signs are now complete. She has had no serious manifestations of hypertension, no major problems with growth velocity. She has had secondary amenorrhea since starting steroids. We move now to labs. Her hemoglobin A1C is 6.4%, despite being on insulin, and her LDL in millimoles per liter is 3.2. With regard to steroid myopathy, the next domain, the patient does have a moderate steroid myopathy. Note that the definitions of minor, moderate, and major steroid myopathy are shown here. So now we move to the cutaneous manifestations of steroid toxicity. And not surprisingly, since the patient has been on steroids for 2 years, she does have some baseline skin effects of steroids. She has minor hirsutism and moderate acne and moderate easy bruising. And note that there are pictures of all of these different skin effects in the digital platform. Moving now to the neuropsychiatric effects of steroids. The patient has had neuropsychiatric effects of steroids. Indeed, she has moderate insomnia and minor mood dysfunction. And the definitions of both moderate insomnia and minor mood dysfunction are included. With regard to infections at baseline, the patient also has oral candidiasis, and this is relevant to GTI scoring at baseline. Before we can complete the data entry for the baseline visit, we need to go through the specific list. It is a list of additional steroid complications that do not affect the overall scoring, but nevertheless are important to note. Now let's go to visit 2. The pGTI, of course, measures change in steroid toxicity, so we can only get the first pGTI score when we have 2 points in time. So the patient is in the clinical trial. Fortunately, although she doesn't know it, and neither does the investigator, she was randomized to the new medication, which is in fact quite effective at reducing steroid toxicity. At the 6-month visit, the patient has had an improvement in her glucose metabolism. She's been able to stop her insulin entirely. She's also been able to reduce her lisinopril from 20 milligrams a day to 10 milligrams a day. So this is a reduction. The investigator is now asked to confirm the intention with regard to these medications to stop the NPH and to reduce the lisinopril. The patient has begun to grow. Her height over the past 6 months has increased to 1.59 meters, and her weight has decreased. Her blood pressure has also improved. It's 135/88. Her hemoglobin A1C has improved somewhat. It's 6.1%, and her LDL is 3.3. Her muscle strength has continued to improve, and she has minor steroid myopathy. And moving on to her skin effects now, the acne has resolved. Easy bruising is now only minor. She now no longer has insomnia, but she still has minor mood dysfunction. And she has not experienced any infections. And fortunately, there are no additional manifestations of steroid toxicity that have occurred here. So there are no specific list items. And we can now get the patient's scores. So at 6 months, one can see the cumulative worsening score indicative of no new steroid toxicity over the course of the preceding 6 months. In contrast, the aggregate improvement score confirms dramatic improvement. Negative scores are good in steroid toxicity, and they indicate that the patient's baseline steroid toxicity has improved substantially. If one looks over to the left of the screen, one can see the individual domain scores between baseline and 6-month follow-up visit. So this is what the aggregate improvement score is comprised of. All of these negative numbers add up to minus 179. Indicative, again, of excellent improvement in her baseline steroid toxicity. Thank you very much.